Hello, this is activity number 3, stages of research 1 and 2, and we are going to talk about an article published in the Nature magazine, an original article, called Association Between Diabetes Mellitus and Oral Health Status in Japanese Adults. We are Erika, Estefanía, Dulce, Alejandra, Andrés, Xavier, and Mayra. First, we have the objectives. The main objective of this investigation is to analyze oral health status, meaning levels of periodontal disease, number of natural teeth, and functional tooth units among Japanese adults with and without diabetes mellitus through a cross-sectional study. And the second one is to determine if there is an association between diabetic status and oral health problems and their outcomes in Japanese adults. And then we have the research questions. The first one of them being, what is the relationship between the diabetes mellitus and oral health status, meaning mainly natural teeth and functional tooth units in Japanese adults? And the second one, what is the influence of the diabetes mellitus over the outcomes of periodontal disease and subsequent tooth loss?
The justification is that in Japan, approximately 70% of the population aged 15 years or older has some degree of periodontal problems. And also, many reports have investigated the relationship between diabetes mellitus and periodontal disease, but none have examined the possible influence of diabetes mellitus on the loss of teeth. The hypothesis is that the loss of natural teeth in diabetic subjects is related to progressive periodontal disease, which have a worse outcome in these patients. They also have fewer functional tooth units compared to non-diabetic subjects.
The article represents significant, simpler research story in concentric groups of their different years in women and men, ranging from 59 years to 69 years. Surveys were carried out where important information that could other the story was taken into account. The mention factories they require employee dental and health damage as such as smoking, laboratory tests were carried out in this case of low diabetes at the win investigation to be a contract. A specific dental tests were performed to look for other variables.
Okay, so I will talk to you about the evaluation of the knowledge deficiency. So we found another approach that can give into the investigation. So where the question is more directed towards diabetes, it will be like, of all the patients who have periodontal disease between diabetics and not diabetics, which group of patient has periodontal disease will progress faster or has more serious injuries, or the time it takes to cure the periodontal disease, which established the treatment. So since with these questions, the most certain thing is that a relationship is found in which patients with the diabetes and periodontal disease are associated with a worse prognosis. And in terms of the recovery severity of their disease, and as well their progress. So that's what we found. Thank you so much.